you're looking for on ethics and legality, this is the one you want to watch. Designed to make this topic easy. 15 questions, just straightforward questions to warm you up, followed by 10 hard questions to get you in shape for your test. Stick around and let's practice some NCLEX questions on legality. First question, straightforward question to warm you up. How should the nurse respond? A nurse is orienting new graduate to a busy unit. The new graduate asks the nurse about what? The law, this is key, the law that governs how personal health of the client are used and disclosed. Your health, things about you, how it's used and disclosed. What is the problem? How do you do that? What do you think? ANA, this is what design your code. Nurse's code, right? Code of ethics is a collection of codes that determine how you act. Of course, this is what determine how your personal health record are used and disclosed. The Bill of Rights is your innate design being that is given to you, so nobody can take it away from you. Your innate rights that is associated with you being a human being, basically. And therefore, HIPAA is the right one. Number 2, which of the following regulation outline the information being discussed? Which regulation? So this test, this kind of ethic and law, pay attention to words. It's all words. Which of the following is a regulation outline the information being disclosed? The nurse is orienting new graduate on client's rights. Pay attention. Client right when receiving care in the healthcare setting. Sometimes they will just define everything for you. When you're receiving care in the healthcare setting, what should define your right? HIPAA does not define your right. It just deals with how we can disclose your medical records, right? The Self-Determined Act deal with the fact that we have to ask you whether you have advanced directives. The emergency and medical treatment and active labor deals with the fact that when you show up in the emergency room, and even if you don't have insurance, we have to treat you. Patient care partnership is the document they give it to you. They outline your rights while you're receiving. So the patient who show up in the hospital, they are designed to receive patient care partnership information, which is all the document to regulate your regulation and your right when you're receiving care. So it's this one. Number 2 done. Third question. What do we have? What's the best action by the nurse? A male client was admitted for pneumonia, buzzword. The wife, who is a charge nurse, right? In another floor, came to the client floor and asked the caring nurse for the client hard copy chart for review. What is the situation? Or the question is asking you, another nurse, charge nurse, who said is the wife of the client, came and said from another floor, hey, I need the hard copy of my husband so that I can review it. What do you think? What do you think? I can assure you we are taking good care of it. Negative. I need permission from the provider. You don't need permission from the provider. There's somebody there you should go get a permission from HIPAA, right? I need power of attorney document as a proof. You don't need power of attorney as a document as a proof. The guy is in the room. Go ask him. I need consent from your husband. Yes. So that's what we need. Straightforward. That's a principle that you have to know. Number 4. Same thing. This test is a concept. If you get the concept, you see that questions are easy, especially ethical and legal issue. Which statement indicates correct understanding of the teaching? A client with decompensated heart failure received teaching about advanced directive. Advanced, you do it ahead. That direct people, that's what it means. I do it ahead, directing people from the nurse. What do you think? which one indicates correct understanding. I will need my PCM to witness my document. The PCM does not witness it at all. I need a surrogate to execute my living will. The living will is what it is, a living will. So a document that is living, basically telling people what they do when you are not capable. You don't need to direct anybody. The will itself is a living. That's why we call it living will. It's a document that is alive. It speaks for itself. So you don't need a surrogate. I would need a power of attorney to sign my advance directives. The power of attorney is the one you give a copy of the advance directive. They should not sign it. It may be falsified, right? I will indicate DNR status in my living will. Yeah, this is what you write in to tell them this is what I want to be done. So this is correct understanding. Number 4. Number 5. What is the best action by the nurse? A unit nurse gave a wrong dose to a client 2 minutes ago. I give you a drug, a wrong dose, right? What would you do? Should you file incident report? Well, the patient get the wrong dose. It may be overdose. Risk management, the patient get the wrong dose. It may be overdose. Assess the client, yes. See the effect of the drug on the client. Notify the child nurse. Patient is in the room dying from the overdose. Go and assess them first before you start doing all these things. It does not matter. Number 6, same strategy I'm using. What ethical principle is being demonstrated by the new nurse? A new graduate nurse gave the wrong dose for a drug to a client 2 minutes ago. The new graduate told the client about it. What ethical principle? I did something wrong and I told you about it. Fidelity is not that, right? You know that this is not beneficence or normoficence because it does not make sense. You are not doing harm or doing good, but it has nothing to do with the patient. You tell the truth even though it hurts. This is it. This is you keep your promise. Okay. Sometimes some people put truth there, but I always use promise and I say you faithful and you keep your promise. Veracity, you basically telling the actual truth, whether it hurts anybody or not. You take responsibility and tell the patient that, hey, this is the issue. And I'm telling you, whether you like it or not, you don't like it, but I'm telling you the truth. I'm not hiding anything. So that's that. Number 7. How would you classify this, right? The client fell and sustained. So a nurse is caring for a client with what? Severe Alzheimer's disease. The nurse left the bed in a high position, both rails down and without a sealer. The client fell and sustained a subdural hematoma requiring immediate evacuation. How will you classify this? Basically, you have a patient who is like severe dementia, okay? Alzheimer's, bad. And you left him bed up, nobody there, all the side rails are down, fell, bad injury. What do you think? You never touch the patient, it can be bad. You never force imprison them. You don't put a place that they don't want to. Malpractice is a secondary to a negligence, a professional negligence. So you did not do standard of care management. That is what negligence, in simple terms, things that anybody, a prudent patient in your standard, same skills would do. You failed to do that. So you were negligent. So that is the issue. A nurse is orienting a new graduate to a busy world about incident reporting. Which of the following the nurse should include? What should you include in incident report or example of incident report? When the client fall, is a form of an incident report. Tampering with medical record, yes. Client elopement, yes. Adverse event during treatment, you got to include it. Physical abuse, yeah, you got to report it so that we can have a record of it, and we can make sure this never happen again. These are all things that are examples of things you have to know for incident reporting. Number 9. Which of the following tort the LPN is committing? A nurse overheard an LPN telling a client during reinforcement teaching on incentive spirometer usage that I will put the mouthpiece myself into your mouth if you don't practice it 10 times an hour. Oh, that's strong, man. What do you think is happening? You have not invaded a client privacy. No. You are not forced imprisonment. You're not putting them in a place that they don't want to be. You verbally threaten them. This is it. You never touch the client. You see what I'm using? One single word every time. Don't make the thing so difficult. One word for each term. These ethics and legality is all words. One word. To assert somebody is all verbal. Never touched. He said, I won't do this. He said, you saying what you planning what you want to do. When you touch the client, you committed the battery, but never touch the client. So it's not a battery. Number 10. The nurse is referring to what term? The same thing, like I told you. You see, we keep on repeating just single words. A nurse is holding a media conference for a new graduate. The nurse discusses the liability with the performance of duties in a specific role for each member of the nursing team. Liability with the performance of duty in a specific role for each member of the nursing team. The nurse is referring to what? What are you referring to? Advocacy, basically, you're just advocating for yourself, and the client, especially, client is number 1. You, the nurse, you have authority to delegate and assign duties to your LPN and the UAP, right? When you do that, when they accept that responsibility, they accept that duty you've given to them, they have responsibility to make sure that job is complete. You will be accountable that if they don't do that, but they have a responsibility to make sure that task they have accepted, you have delegated, is performed. So the liability, and if something happens, they are liable for that. So the liability with the performance of that duty in a specific role for each member is a responsibility. When you accepted a job, a task from the nurse, you have assumed responsibility and you are liable to that. The nurse may be accountable, but you are the one who's liable. A new graduate about client confidentiality. Which of the following situation the nurse should include as a violation? Selected apply. A nurse give admission diagnosis to a client family member. Red flag there, right? Red flag. You can't do that without patient consent. A nurse allow family member to read the medical record. Bad. Without a patient consent. A nurse discusses client status to another nurse on different ward. Bad. A nurse share client status to incoming nurse during change of shift. Yeah, if I'm taking care of the client now, I'm coming in. Yeah, you can share those information with me. So that's good. That's the 1, 2, 3 are violations. Number 12. What is the nurse best action? A client with DNR order is intubated in the ICU for respiratory failure. The monitor alarm went off due to VFib. That changes to asystole. The wife pushes the code card in the room and said to the nurse, please do something. What is the nurse best action? Follow instruction. Patient has an order. Do not resuscitate. It went to VFib and asystole. Now wife want to bring him back. Good luck with that. Okay, no need to call a code. Don't begin high quality CPR on the client wishes. Defibrillator is not needed. Number 13. 3-year-old present to the pediatric clinic with laceration to the left hand, oozing blood. Okay. The nurse suspects child abuse. What is the nurse best action? Child abuse, nurse best action is all safety for the client first. Safety is your priority. Notify the doctor is not important. Apply pressure to the wound. The thing is bleeding. Okay, pressure, dress it, assess the patient, and take some information and dress it. Report it to the manager. The client needs safety. This does not provide safety. Call the police. All these things are important, but number one, your priority, the best action, the thing is oozing. Put some gauze on it. This request may constitute what? A spar of a client with new diagnosis, brain tumor, told the nurse not to disclose the new diagnosis to the client. What do you think is happening if you honor this request? Okay, somebody has brain diagnosis, tumor, and you don't want to tell the patient. Malpractice is not. It's usually malpractice is negligence by profession. There's no, nothing's been filed in court or anything like that becoming malpractice, right? Violation of fidelity. You always know fidelity is faithful and following the truth, but this is not a situation that it does not apply here. You know, you're being faithful and following truth and staying loyal. You're keeping your promise. That's why I like the promise. Promise make it easy. It has not promised the client anything, so there's no need in it. Negligence, yeah. If you hold the truth, lack of communication about patient condition to anybody, especially the healthcare team, the doctor, the patient itself, you can be charged with negligence. So that's negligence. You are not invading their privacy. So know that if you hold the information from the client, it can be considered as a negligence. That's not standard of care. 15. A nurse was teaching a client about procedure informed consent and which element must be included. Which item indicate correct understanding of the teaching? Select all that apply. Alternative procedure. Yes, you need to tell the patient that there's another procedure that can save their life. Risks and benefit of what you're going to do. What is the indication of the surgery you're going to do? You have to describe to them in medical terms. No, they are not medical folks, layman terms. So this is not included. Okay. Expected outcome. Yeah, what is going to happen when I let you cut me? Okay, so 1, 2, 3, 5 are your right answer. You don't need to discuss it in medical terms. 10 more questions. Let's do this. What ethical principle being demonstrated? Hospital decided to ensure smoothly operation in the emergency room by what? Taking intake history based on time of arrival and not insurance status. A bunch of ways, like I told you. Keywords. The hospital want to operate on based on what? The time you arrive, so that they can ensure smooth delivery of emergency care. Not because you have insurance or no insurance, because you go there, there's some people who have insurance sitting there. No. So what are they doing? Autonomy. This has nothing to do with you. They're being good, but they're not harming anybody, right? What they're trying to be is to be fair. And to be fair is to show justice. So that's what they're trying to do. This is the way they will ask you the questions, to use what you know. So they will not ask you what is justice. They want you to demonstrate, right? This is another question. These ones will all thinking questions. Select or apply. 5 clients are in the emergency room. Who can be allowed to leave against medical advice? You know the criteria of medical advice. It cannot be what? Intoxicated. It cannot be at the risk of harming somebody or themselves. They can take care of themselves. They are not in legal hold. And then they're competent. They can leave, right? Client with schizophrenia is disheveled and catatonic features. This guy cannot take care of himself. He can leave. Client who attempted hanging episode is suicidal. He can leave. Client with lorazepam overdose. It's a drug overdose. He can live. He's impaired. Client who threatened to kill the spouse, homicidal. He can live. You get the strategy. So those are the strategies I want you to pay attention to. Client with what? Ruptured aortic aneurysm, right? There's nothing, there's no drug, there's nothing. I intentionally left the competent, but all of them are competent, right? All of them, yeah, I left it that to make it vague as much as possible, but straightforward. This is what I give you. You cannot overthink it. Okay. So client with ruptured aortic aneurysm. Is there anything there that tell you he cannot take care of himself? Is there anything he's overdose? He's going to kill anybody or do anything? No, there's nothing there. This client, he can leave if he want to leave. If he want to stay, we will take care of himself. So that's the problem. That's not a problem at all. So 5 will be allowed. Only 1. Number 18. Select or apply. Which of the following should be included in the teaching? A charge nurse is teaching new graduate about ethical principles. Same thing. You know what it is, right? Which one should be included? Veracity, right? It's not keeping your promise. It's telling the truth, even though if it hurts. Fidelity, you keep your promise. Autonomy, make your own decisions. So this is right. Beneficence, you are being good and no malfeasance. You don't do no harm. So I flip them so that you can know the definition. And this is the way I define it. I don't use too many words to make it easy for you, right? So those are the only one is only one answer. If you pick more than one, you get it. Pick those you're confident. So only number 3 is the right answer. The others have been flipped back on itself. Number 19. What was the purpose of the report? As we've talked about, right? I read from the back, test taking skills. A client fell from the hospital bed and broke the leg. An incident report was filed by the caring nurse. Why was the report filed? Avoid malpractice? No way. Investigate the nurse negligence? We know she's negligent. That's not the reason why. Create new policies? No. We can create new policies whether patient fell from the hospital or not to mitigation of future occurrence of that nature. This is what all the topic we did. I just want to let you over review it because this is how they can trap you. The main thing was to prevent future occurrence. We can make policies without somebody falling. We are not trying to investigate their negligence. We want to prevent future occurrence. That is the key. Number 20. Which organization was discussed? Which one? A nurse is teaching future nursing school student, future, right? About the organization, look, pay attention, responsible for providing the minimum competency and qualification for nurses to practice medicine. A long word. I said this to confuse you, but to show you how the board can do that. All you need to do is step back, look at the words. These are our words. All I'm saying is which organization is responsible. They're providing you just minimum competency and qualification so that you can practice. National Council License Examination, that's the test you take. They don't provide it. The name of the test you take is that, right? That's the NCLEX, right? Accredited Commission for Education in NC. They give the school names. I mean, they accredit the schools that you went to so that they can function as a tertiary institution. The word is what? Accreditation. Right? American Nurses Association, you know, they involve in your scope of practice. The people who give you the minimum qualification and competency is the nursing board. That is what your test is about, is to test whether you have a minimal competency. That's why they're not making you expert. They're making you bare minimum entrance to the nursing field. They don't want you to like build a house or write a dissertation of aortic aneurysm. No, that's not the idea. It's to make you, just to give you competence, but the competence is the minimum as much as possible so that they can be confident that when you go to the floor, you make a decision that is enough to save the patient life by being sharp. So qualification. That's all. So D, number 4 is your right answer. They don't want to make you an expert. It's just an entry-level nurse. And the entry-level nurse need a minimal competency and qualification. Number 21. What do we have? What is the nurse's best action? A nurse attempts to give a client with CHF the schedule digoxin, okay, their medication. The client refused and said, I don't like the way it make me feel. I hate this medication. I don't like the way it make you feel. What should you do? Buzzwords. Patient is on digoxin. You try to give it to them. Say, I'm not taking it. I don't like the way it make me feel. What should you do? Notify the prescriber. What is he going to do? Come and convince the patient? Document the refusal? You have time to do something else. Provide teaching about the medication. Yeah. Give them a teaching. Say, Mr. So and so, this is the why you're taking this medication. If you don't take it, this is what will happen. If they refuse again, then you go and document. But for now, yeah. Notify the charge nurse. He's not going to do anything. Charge nurse and prescriber, what? They're going to do the same thing you're going to do. Come and talk to the patient and say, please take it because it's for your heart failure. Why don't you do that? You are the nurse first before you call them. Number 3 is your right answer. Number 22. Which of the following consent obtained from the client the nurse should consider invalid? This is about consent. I'm trying to get you thinking. Which one is invalid? You know the criteria. A 16-year-old army sergeant with appendicitis. Well, is underage, right? Is a minor, 18 years old, less than 18. But he's an army sergeant. He can consent on his own. So this is good. A 15-year-old single for alcohol rehabilitation. Minor, but what? Is asking for substance abuse. Is okay. A 14-year-old single for gonorrhea treatment. STI, sexually transmitted disease. They can do it on their own. They don't need their parent consent. A 16-year-old single for wisdom teeth extraction. This is not an emergency. It does not meet any of these criteria. It's a routine procedure. You can't just go and say, I want my wisdom teeth out. You need your parent permission. This is a 16-year-old. So this patient, we should consider the consent invalid. Number 23. Same strategy, okay? And a charge nurse is teaching new graduate about intentional. You did something, intentional thought. That means you intentionally did it. Which of the following is considered slander? I try to make it easy for you. You know intentional thought is what? False imprisonment, okay? Battery, you assaulted the patient, okay? And I put them as quasi intentional thought. Slander and libel or labor, right? Libel law, right? Those two, which one does that belong to? Slander, you talking, speaking. Labor or libel is what? Library. So in the books. This in the books. So written down. Spoken, slander, S. You talk about it. So any of them that I'm talking about them, I'm picking it as an answer. And next, post an untrue story about another nurse on Instagram. Is the word is what? Post. This is a library, so it can be a slander. A unit clerk falsely telling another clerk that the charge nurse is a drug addict. Spoken, slander. So this is good. A nurse telling another nurse about a fight he or she had with the charge nurse. They had this is the trap, right? There was a fight, and he's just telling you another nurse what happened. He's just telling. He's not slandering or anything like that. We had a fight yesterday, and I'm talking about the fight. I never say forcefully. It just happened. So this is not. A nurse shares the charge nurse diagnosis with another nurse. Think about it. A nurse shares the charge nurse diagnosis with another nurse. I tell another nurse about your diagnosis. I never say it's false. It was a true diagnosis. What are you doing? You're just violating their privacy. You violating HIPAA rule. You're not supposed to share somebody's diagnosis with another person. But there's no slander. I'm just telling them your diagnosis. So the only thing that is slander is number 2. Pay attention to the way questions are said. And then you see that it's easy to pick an answer. Select or apply. 5, client present to the emergency room. Which of the following consent the nurse should consider valid? It's the opposite that we show. So validity, 13-year-old with appendicitis, mother sign it. Is a minor, the mother sign it. It's okay. 75-year-old with dementia, durable of attorney signed the consent. Yeah, it's demented, durable attorney is being can sign the consent. 30-year-old intoxicated is impaired with epidural hematoma, taken to surgery without consent. Yes, it's implied consent. It's valid. Implied because the patient is impaired. He can't do that. And the patient, if we don't do anything, is going to die. Epidural hematoma, he will die from it. This is a bad diagnosis. So you're looking for a bad diagnosis that if you don't do anything, patient die. A 45-year-old comatose badness with abdominal bruit, taken to surgery without consent. These are the things you have to think. I did this, it's like a case form for you. This is the buzzwords in the case form. A comatose patient with the bruit, this is a AAA rupture, triple A, aortic abdominal aneurysm rupture. There's a bruit there. And because his comatose is bleeding, he's going to die. We got to take them to surgery. This is fine. 25-year-old intoxicated with ankle fracture, taken to surgery without consent. This was a trap. We got to call and see if we can find family. This ankle fracture is not going to kill them. It's not something that will kill them. So we have opportunity to call. I have to say, consider that I have to ask the doctor, hey, this is ankle fracture. Let's find the doctor, hey, next of kin, parent, or anybody around to see who can sign. He's intoxicated. He can't do that, even though he's not a minor. The parent or the wife or somebody has to sign. But we got to contact next of kin, parent, and see if they are available. So this one is not valid. So 1, 2, 3, and 4 are valid. And the last one, select or apply. And nurse is teaching new graduate about HIPAA law. Which of the following must be employed under HIPAA to be considered an incidental disclosure that must be included in the teaching? A bunch of words. When you see this, they're trying to trap you. Step back, look at it. They say HIPAA, but which one can I do to ensure incidental disclosure? That means I can violate HIPAA law and I consider it as incidental. It happened accidentally. I did not plan to expose that individual variable information. But if I make precaution for that and it happened, I'm good. If you use curtain and the roommate hear it, you are good. Use curtain in semi-private spaces. Yes. List names on the whiteboard at the nurse station. That means nobody can see it. It's between the nurses themselves. The public cannot see it. That's good. Communicate in lower voice in semi-private room. Yeah, I can't block the other roommate here. I was speaking in lower voice. If you hear me at all, that's fine. I'm still not violating the patient. Communicating whiteboard at places least visible to the public. Yeah, if I'm writing names of the patient, It should be far away from the public as much as possible. Tell roommates precaution to take in semi-private room. Yeah, if we are in the room and you have flu, I can tell you wear a mask. Your roommates, you need to wear a mask. He's getting sick so that you don't get sick. We should be fine. So all of this can be employed to consider incidental disclosure. This is the end of it. Comprehensive ethics and legal review with the 25 questions. It's helpful and serves as a resources for you. If you have not subscribed, check the subscription down and click it so that you can get more videos when I make them. Take care of yourself and good luck in your exams.